Hi everyone and welcome back to FlashlightMedics, the online medical education portal designed to help you excel in your medical studies. Today we're going to be learning about how to interpret the chest x-ray. Interpreting chest x-rays is a fundamental skill all junior doctors should be able to master as part of the investigation and management of the patient. We often learn these skills when we're medical students and it can be quite overwhelming. Before you learn how to interpret a chest x-ray, make sure that you check out our previous video where we learned about the anatomy of a chest x-ray. So let's begin. Interpreting chest x-rays as a medical student can be quite overwhelming, but it's really important that you use a structured approach. Being able to interpret a chest x-ray is important as part of your clinical work, but you'll also be able to demonstrate in exams that you know how to interpret an x-ray confidently. When interpreting a chest x-ray, we often use a systematic structured approach, which will help you navigate your way through the station. It's important to be clear and concise and to speak aloud to the examiner what your findings and interpretation are. As well as that, make sure that you use appropriate medical terminology whenever it's possible. The first step in interpreting a chest x-ray is to be able to identify the details of the patient. This seems very basic, but being able to identify the date, the time, the name of the patient correctly and demonstrating to the examiner that you recognize the demographic details of the film are consistent with that of your patient. The next step is to be able to identify whether it is a PA film or an AP film. PA stands for posterior anterior. It refers to the way that the X-ray beams are emitted in accordance with the positioning of the patient. The ideal film for chest X-rays is a posterior anterior view because it gives you the best view that's possible for a chest X-ray. If you have an AP view for a chest x-ray, there may be certain areas that may appear larger than normal. For example, the heart on an AP view can appear larger, but this falsely alludes that there is the presence of an enlarged heart, when really it's just the way that the film is appearing on the radiographic screen. So being able to identify whether it's a PA or an AP film is very important, in addition to navigating the left and the right areas of the x-ray. The next step is to be able to comment on the quality of the film. We often use the abbreviation RIPE, R-I-P-E. This stands for rotation, inspiration, penetration, and exposure. Let's have a look at each one in turn. The first step of the RIPE algorithm stands for rotation. In order to determine whether a film is rotated, you need to identify the presence of the trachea. In the last video, we described how to locate the trachea. It's a linear structure which is located in the upper part of the thoracic cavity, and you can identify it because there are the presence of spinous processes which are located right in the middle. Ideally, the trachea and the spinous processes should lie equidistant, and what that refers to is right in the middle between the medial heads of the clavicles on either side. We say that a film is rotated if the difference between the medial heads of the clavicle and the spinous processes is unequal between either side. Rotation is important because in a film that is rotated, you may not be able to identify the structures correctly, and there is a chance that various findings will not be picked up. The next step is to comment on the inspiration of the film. Ideally, a film should have a good level of inspiration where you should be able to see all of the 12 anterior ribs and all of the 12 posterior ribs. You can identify the anterior ribs because they curve inwards towards the center of the chest, and equally you can identify the posterior ribs because they curve outwards and downwards away from the center of the chest. It is important to highlight if the chest x-ray is showing a poor inspiration because it may not be able to show up significant structures. Equally, it's important to identify if there is a hyperexpanded film. A hyperexpanded film demonstrates a large thoracic cavity, and this is often found in COPD patients where they often have flattened diaphragms or a barrel-shaped chest. In this situation, it's very important to recognize that this is a hyperexpanded film. The next step is to identify what sort of penetration is present on your chest X-ray. Penetration is important because it could affect the clarity and the quality of the film. If a film is over-penetrated, then there may be a sharp contrast between the different areas, and that can sometimes lead to difficulties in interpretation. Equally, if it is under-penetrated, then the film can appear hazy, fluffy, and it can be difficult to differentiate and therefore to miss significant areas and significant structures. In an under-penetrated film, it would be very difficult to distinguish the left hemidiaphragm compared to the spine. In addition, the lung tissue behind the heart won't be able to be assessed clearly. The last step of the RIPE algorithm is to determine the exposure. A good exposure means that the chest X-ray contains all of the significant areas that we want to see in order to get an adequate view. In addition to the core structures we would expect to see on a chest X-ray, such as the heart, diaphragm, trachea and lungs, it's important to identify whether there are specific features seen on the X-ray to determine whether there is a good level of exposure. We should be able to identify the apices on either side of the lungs, because these are significant areas where pathologies may present, and we'll come back to this later on in the video. We should be able to identify the areas under the diaphragm on either side of the chest, and ensure that no areas of the chest cavity have been cut off from the field of view. If all of these criteria are met, then we would say that there is a good exposure to the chest X-ray film. So now that we have commented on the quality of the film, it's now time to move on to interpreting the X-ray itself. There are different ways on how to interpret a chest X-ray, but one of the strategies that we use within this video is to start based on location. In this interpretation, we're going to start from the top of the chest X-ray film, work our way down, and then move up towards the peripheries. The first structure we identify would be the presence of the trachea, and we know that it's the trachea because, as we mentioned before, it's in the upper part of the thoracic cavity, it's linear, and you can identify the presence of air within the structure. It also has the presence of spinous processes traversing the center. We then move down to the bronchial arch, which subdivides into the left and the right main bronchi. The right main bronchus is slightly more vertical and higher compared to the left, and this is significant in cases of a foreign body insertion because it's much more likely to go down this route and end up in the right lung. The next structure to identify would be the heart itself, which sits in the middle of the thoracic cavity. On either side of the heart you can identify the presence of the hilar, which are made up of the vascular structures in addition to the lymph nodes. Sometimes you might identify that there's a hypervascularity or enlarged lymph nodes within these regions. It's important to comment whether you think that the hilum is enlarged. In describing the heart, it's important to comment whether it is enlarged. This is significant in cases of cardiac failure, where you might see the presence of an enlarged heart. We're able to determine whether a heart is enlarged by working out two diameters. The cardiac diameter is located on either side of the cardiac margins, and the cardiothoracic diameter is located between the center of the heart and also the chest wall. If the cardiac diameter is larger than the cardiothoracic diameter, that would mean that the ratio is enlarged. If the ratio is more than 0.5, then that means that there is true cardiomegaly. The next step is to identify the cardiophrenic angles, which are located between the margin of the heart and the diaphragm. These angles should be clearly defined and very sharp. They can sometimes appear hazy or blunted if there is the presence of fluid, as would occur if there was a pleural effusion or the presence of pulmonary edema. The next step is to identify the presence of the costophrenic angles. They are located between the diaphragm and the chest wall. They should appear well defined, and they should also appear quite sharp. It's important to comment on the diaphragm, and you can identify that the right hemidiaphragm is higher compared to the left. You may see the presence of gastric bubble underneath the left hemidiaphragm, and this is entirely normal. The next step in the interpretation is to identify the different lobes of the lung. The right lung has 3 lobes, the upper, middle and lower lobe, and the left lung has 2 lobes, the upper lobe and the lower lobe. There are a range of different pathologies that could be identified by examining these different areas in detail, such as the presence of consolidation, the presence of suspicious masses, and also the presence of a pneumothorax. The next step is to comment on the skeletal structure, such as the vertebra which traverses the center of the thoracic cavity, and also to identify the clavicles. The last step of the chest X-ray interpretation is to comment on the review areas. Review areas are often missed when interpreting X-rays, for instance in the cases of Vanilski exam. The review areas consist of the apices of the lungs, the hilar regions, and the retrocardiac areas. These are areas where you might find suspicious pathology, such as the presence of a suspicious mass. Finally, it's time to summarize the findings of the chest X-ray interpretation. This is usually done by summarizing the demographic details of the patient in addition to the presenting symptoms, a brief summary of the quality of the film in addition to summarizing the key features and positive findings. The summary should be followed by a list of differential diagnoses, ideally 3 of them, including the rationale for why you have chosen the top differential. In summary, in order to interpret the chest X-ray, it's important to clarify the demographic details of your patient, to comment on the quality of the film using the algorithm RIPE, rotation, inspiration, penetration and exposure, followed by a top-to-bottom approach in interpreting the X-ray. So that's it guys, that's our video on how to interpret the chest X-ray. Make sure that you like our video and subscribe in order to enjoy future videos from our channel. Thanks very much for joining and we'll see you on our next video.